This video is to show you how to change your dressing after you come home, usually the first 48 hours later after you've had ligament surgery or any major knee surgery where you have a brace on your leg. So this video is going to go through the steps of taking the dressing off and then how to put things back together. So this is probably something like your dressing looks like. On our model here we have a different kind of stocking, but most have a white stocking on the leg which covers everything and just keeps everything contained. The brace has hinges at the center which should be locked and to keep your legs straight. So when you want to change your dressing, the straps come off, they hook over a small connector over here, and you just loosen all of the straps first. When you do that, this brace will open up like a book. You can just leave the brace there. The next step, I forgot to mention, you should wash your hands before you do this and then get them nice and dry. The next step is that you pull the stocking down. You don't have to take it off, but just pull it down far enough that you can see the dressing. So the next step is to take off the ace bandage, and you may want to roll it up as you take it off because that way it's a lot easier to put on. You'll be replacing this later. Now sometimes there's a little bit of blood on the dressings, so don't be alarmed unless it's actively bleeding. Of course, that's extremely rare, but if you see any bleeding, then you would want to call us. But if it's some dried blood or looks like it was fresh, then you can just, usually it's from right after surgery when we put the dressing on. Then you can just pull apart this little soft cotton padding that just holds the cold therapy pad in place if you have one. Now, as you've probably been told, the cold therapy unit's wonderful for reducing swelling, but the big point of it is that you don't want this touching the skin anywhere, or you can get a third-degree burn. So make sure there's a barrier between the pad and your skin always. Under the pad will be another layer of this cotton padding. So again, if you have a pair of scissors, you can cut it off, or it's very soft and it just pulls apart very easily. For purposes of our demonstration today, I'm just going to pull it apart. Now, when you get down to the final layer, you'll have some 4x4 gauze dressings. At this point, I generally would just slip out the dirty dressing and put it in the trash because you're not going to use that again. So these gauze pads come off, and then you're down to the incisions. Now, your knee may be kind of swollen, and I know that's kind of freaky when you see that, but it'll go down in a few days. But you'll see these little yellow tapes. These are basically just some gauze with Vaseline in it, and the reason we put these on is so that when you peel them off, it doesn't stick to the stitch. But these should come off. You can pull those off, and these 3 small incisions will each usually have 1 stitch in them. And if you had a ligament reconstruction, you'll have another smaller incision down on your shin with these steri strips in place. So take off the yellow gauze, but leave the steri strips in place because they're holding your skin together. Don't remove those. If you do, your skin may tend to spread a little bit and you may end up with a wider scar. So now you've got your dressing changed. So what do you do now? Well, we want to basically you want to rebuild your dressing. So on the incisions here, you can put a small Band-Aid, or if you have some clean 4x4 gauzes, and I recommend that you get some before you do the dressing change, you can just put 1 or 2 over the incisions so the brace doesn't rub on it. You can just lay these back on. Of course, these will be clean for the new one. And then you pull the stocking back up. Guys, this will be hard for you because you probably never put on stockings before, although in San Francisco many do have that experience. And so then you pull this back up just to cover the wounds. That makes a nice barrier for your cold pad. The next step is to put the cold pad back on your leg, and at this point you're usually 2 days post-op, so I don't recommend you leave it on 24/7. I want you to take the cold pad on and off your leg every 2 hours, and definitely at nighttime, because at nighttime you want your leg to get a little air, and you'll find that the cold pad side gets a little sweaty, sometimes a little moist. So you take that off when you're not using it, and then you wrap it onto the leg with the ace wrap. Now again, you're on top of the stocking at this point in time because it will be much easier to remove it. You can leave your wounds and dressings alone. Now this can overlap. Your cold pad can overlap a little bit. It doesn't hurt a thing. And then you just actually wrap this back up lightly. You don't have to be tight. We don't like tight. And you put this back on. You're almost done. So the last step is to get the brace lined up. Now let's say the brace is sitting over here. Let's say if you flip it off and you go, okay, now I got to put this back on. Oh my God, what am I going to do with this? So if you can lift your leg up, you grab the two hinges. There's a hinge on one side and there's a hinge on the other side. You grab the hinges and you put it right at the center of the kneecap. So here's your kneecap, so put these like earmuffs on a face. You line that up, and if you need to, I will show you a secret about these braces. This little yellow tab here you can pull up, and voila, the brace will bend. And it's a little easier to put it on if you want to do that. I prefer you don't do this until you come back to the office the first week. But if you have to, you can. So you put the hinges on the knee and line them up in front of the kneecap. The side of the brace here aims towards your ankle bones. And up in your groin, the side aims up towards your groin there. And the side one here aims towards the side of your hip bone. So that basically it's nice and lined up straight. At that point, you can then take the straps, I would start at the bottom, and hook it back on, and just get it in place. Now remember, after you change the dressing, the brace may be a little bit loose, and I'll show you a trick on how to tighten that up. So we're going to hook all these back on. Well, this was pretty loose, so what are we going to do? How are we going to adjust that? Well, you might think, okay, I'm just going to pull here. You can just pull it tighter here, but sometimes you'll still have some slack behind. So what I recommend is you unhook it. There's a Velcro piece right over here. You pull the strap away, and then you can pull it up from behind and tighten it in back first. And then lay it over, click it in, and then you can tighten it here. So I'll show you again on the lower one. Again, before you tighten the straps up, pull it back, disengage it from the Velcro on the side, pull up on it a little bit, give it a little tug, loosen your strap, put it on the front, and then you can tighten it here. These straps can be shortened if they're too long for you, because they do have a little Velcro tab at the end. So you can take off the little sticker, pull it off, cut it. I would really warn you on this one not to cut it too short, but I usually leave them so that they can attach right there, or on the thigh ones I'll cut them up to about there. But on the shin ones I leave them a little bit longer. So you can put that back on and then just push it around the back and it will connect in the back. So that's how your brace is put back together. Now make sure if you've unloosened the hinge that you clip the yellow piece and lock it. The best way to do that is push down on the hinge first and then click it to lock it. I would again recommend you can get in and out of this brace several times a day to get into your CPM, and you can also take the cold pad off whenever you don't need to use it. So hopefully that helps you through your journey of getting your brace and your dressing changed.